So for the purpose of this demonstration, we're going to use this model that has displaced centrals as if they were traumatically pushed in a lingual direction. So using this as our patient, the armamentarium that we're using is a combination of end-cutting pliers, bird beak pliers, and 3-prong or adder pliers. Mirror Explorer, some 021 gauge ortho wire that's braided, and we have some measuring devices along with etch and prime, adhesive, phosphoric acid, and silane coupling agent for ceramic primer. We're also going to utilize flowable composite for this process and to help stabilize the splinted wire. So first off, what we would do is when our patient arrives, obviously you're going to take PAs and the necessary diagnostics to check the bone and the ligaments and the PDL around the teeth. And deeming that everything is restorable, what we're going to do first off is to take a measurement of how much wire we would need for splinting. You can use different rulers, you can use a flexible ruler. For this purpose, trying to keep it simple, we're just going to use a piece of dental floss. So if you have someone to help, that's great. What we do is you can take the dental floss and place it, on this case for canine to canine, we're going to lay the floss across the teeth, and so doing such, we place this in our patient's mouth, get a measurement for the length of wire that we need, at approximately the heights of contours of the teeth. Holding that in place, you would have someone help you use a marker or some marking device, and I measure from the distal of the canines to the distal of the canine, and with that measurement, we have the length of wire that we're going to utilize. So, using our orthodontic wire, that would be opened and on a tray. Take our wire out. I typically don't have anything pre-cut because you don't know how much you're going to need right off. And so once you take this and you mark on your wire the length of wire that is necessary, you can use your end cutting pliers or whatever device you deem appropriate in your office. It could be wire cutters to cut a piece of segmented wire that is going to be used for the splint stabilization. So once the wire has been cut, we'll use our bird beak pliers to create small curves on the end of the wire, and I use this to help stabilize the wire once it's in place. So you'd go through the process of making sure the teeth are clean, not contaminated with any either biofilm, blood, or any other objects. I would use the etch and prime and adhesive. If they have a ceramic crown in the mix that's going to be bonded to, you can air braid the facial of that crown and use the 7% hydrofluoric acid, and then you're going to add the ceramic primer to any restorations that have been in place. And so once everything is in place and everything's been applied, the chemicals have been applied to the teeth, we're going to stabilize the teeth by pushing them back into place. Obviously, this can be quite uncomfortable for the patient, so they would be anesthetized for this. The wire is put in place, and then what I will do is I will take the flowable, keeping those teeth in place, aligning the wire approximately on the mid facials of the teeth. And you'll see how this little curly Q comes into play here. So holding it in place, we will place a little dollop of flowable. Take our curing light. Tack the wire in place for the appropriate length of time. Again, holding the teeth in place where they're to be stabilized. And lastly, obviously this gets manipulated around in my hands a little bit, and the patient wouldn't be like that, but you'd have someone assisting you to keep everything in the proper orientation. And we have the splinting process complete. Again, you can add a little bit on the laterals. Braided wire is preferred because it remains flexible. You don't want anything rigid. You don't want to splint the teeth together with composite, which could potentially create ankylosis. So teeth are splinted in place. You can use an enhanced cup or some kind of finishing device to smooth and blend the composite material against the teeth. The teeth are now aligned, and we allow them to heal. Typically, we'll leave the splint on for 4 weeks, and then we can remove it. Just by a matter of using some discs and removing the flowable composite, lifting the wire out and polishing the rest of the teeth and the restoration if that is necessary. So that is the splinting technique, using stuff that materials that you have in your office at hand for doing fillings. If you don't have the orthodontic wires, or you can get from your orthodontist, again, I'll put that in the references as to what wire this is. Again, for the pliers that are used, I happen to have these from school, but if necessary, you can use a pair of needle nose pliers and a pair of wire cutters. These are great in case you're splinting somewhere towards the posterior, because they can slide down next to the cheek and cut the wire without creating any damage, and they've got a great angle on them to make the cut. Again, you could use needle nose, you can use wire cutters, and always measure your wire for the length that is appropriate. Sometimes we'll splint a canine and lateral together if someone's been struck from the side. And of course, then we're going to go from a premolar to probably the contralateral central. So you kind of adapt each splinting situation to what needs to be stabilized. And when all is said and done, everything can be removed. And if restorations are necessary or any other treatment is necessary, you go from there. But that is the basic splinting technique.